Hey Brittany, thanks for coming to talk with us about your project, which was really exciting and really fun to see progress. So I guess maybe the first thing would be if you could just describe for us what your project was.
Sure. Well, my project was basically about health disparities in Oakland, California, looking specifically at East Oakland and trying to look at what sorts of things about a neighborhood in East Oakland called Castlemont are contributing to health disparities. So neighborhood factors like access to healthy food or pollution or even just blight, and how those affect people's health in some direct and some more indirect ways, and kind of how those end up shortening people's life expectancy.
And how did you first decide on that as your master's project? What sort of triggered that interest for you?
Last year, I was reading a report from the Alameda County Public Health Department. It's called Life and Death from Unnatural Causes. And I came across this statistic that an African-American child born in West Oakland is going to live, on average, 15 years less than a white child growing up in the Oakland Hills. And that statistic really struck me because, it's based on race, it's based on income, and it's based on where you live. And I hadn't thought about how health could be so different in places that are just a few miles apart.
And so what were the factors as you were doing the project that you came across that sort of influenced this difference in life expectancy?
Well, I started with a bunch of data from the county health department, kind of putting those on maps. So I looked at things like asthma, obesity, diabetes, homicide and assault, and then rates of chronic heart disease and stroke, and started to notice that, I put them on a map and the red areas were the problem areas in Oakland, and these all happened to be in the same neighborhood. So one census tract in particular in Oakland called Castlemont had really bad health outcomes across the board. And so I went there, started walking around the streets, talking to people, talking to community groups who are working on health about what it is about the neighborhood that's making people unhealthy. And, started to figure out it's things like access to healthy food. For instance, in Castlemont, there aren't any grocery stores for 4 or 5 miles and a bunch of liquor stores and fast food, which makes them more likely to have an unhealthy diet and more likely to develop diabetes or obesity. And then it's also things like in this neighborhood and in East and West Oakland in general, these low-income families are more likely to live, close to a freeway or close to a factory. And so more of them have asthma. So it's things like that that kind of build up over time. And then I started looking at kind of the more insidious effects of these neighborhoods on long-term health. And you don't only get asthma, but you also are missing more school if you're a student who has asthma, which then sets you behind in your studies, and then in the end makes you less likely to graduate in general, and then less likely to get a job, and less likely to have access even later in life to things that will make you healthy, like good housing, or a good job, or healthy food.
How did you find that the factor of violence played into it as well?
Sure. Violence, besides the obvious one that somebody's more likely to be shot and killed in a violent neighborhood, there's also factors like living in an environment where you feel unsafe can cause you to feel stressed, which actually wears on your body over time. And there's studies that have said, having a constant state of adrenaline because you feel unsafe actually affects the way your brain develops. So for youth, for example, it can make it harder for them to learn in school and retain information.
You did your project as a multimedia project, and so I'm wondering what that added, from your perspective, what that added to the project as opposed to, say, if you'd done it as a documentary or a long-form narrative written piece.
I ended up doing it as a multimedia project because I started with a lot of data. And so part of this experience for me is making the data that I use to report available to the people who are reading the story. So I wanted a way to make that accessible and have people able to interact with the data. So a big part of this project was this set of interactive maps that are on the website, pulseofoakland.com. And you can go in and I tell you within the text of the story that the asthma rates in East Oakland are much higher than the rest of Oakland. But you can also see that yourself on the map where the data is displayed, you can click on it, you can interact with it. And you can see the data for all of the health factors, you can see demographic data. And that was really important to me as a way of having people engage with the story.
And so what's your hope for what the afterlife of this project is? It'll now be on the web. What do you hope people get from it? Who do you hope actually accesses it? And so on.
I think that, this project was really important to me to get the word out about this concept that where you live has a huge influence on how healthy you are, because the unhealthy neighborhoods end up also being the low-income neighborhoods and are also neighborhoods that are largely African American and Latino here in Oakland. And that was really important to get the word out about that, because there are health initiatives at the county health department and other groups and organizations that are starting to work in what they call a place-based strategy, where they focus on a neighborhood and try to bring the resources people need to be healthy to that neighborhood. But it's not yet the norm, and the health department and other groups are trying to move towards looking at the landscape behind people and giving people the resources where they live. But for that to really happen, there needs to be a lot more awareness that a good chunk of how healthy you are is related to where you live.
Do you think that the project has changed you and your attitudes towards what you'd like to do with your journalism?
I think that this project has really cemented what I want to do as a journalist. I've always been interested in public health reporting, and I've always been interested in multimedia, and this project really let me combine the two and see how multimedia provides a lot of opportunities to engage with the story in a different way. So interactive maps and photos and text and a video all in one place can be a really powerful way to tell a story.
Well, thanks a lot for talking with us.
Yeah.
It was really good to hear about how the project came together and what you did with it, and I think it looks great.
Yeah, it's a great experience. Thanks.